Look, I'm going to tell you this, and I'm going to tell you this, like, be honest. You're not alone. There's people out here that's trying to help you. You know, it's going to be hard. It's going to be a whole life change. It's not the end of your life. It's a life change.
The dialysis treatment impacts mind body, and it gradually is wearing down my body,
Yeah, it will do that.
um, that I'm actually gonna do a video on this, but regarding like the flow, the blood
Mhm,
speed flow,
mhm.
that now I have to go to a lower flow in order for me to actually be able to do dialysis.
I'm
Uh,
sorry, say it again.
I have to go to a lower flow, a
Yeah,
blood speed flow in order for me to do
yeah,
dialysis.
yeah. Because I'm be honest with you. That's what messed up my heart, and I had to go to heart surgery because of that. Because
Mm,
another dialysis center would speed it up, and my heart can't take it.
mm,
And then I found myself getting a heart surgery because a valve was messed up in my heart.
mm.
So yeah, you're all right. You're pretty much on the right path. That's
Okay.
wonderful. That's a good question to ask, and that's a good thing to let people know because
Yeah.
you will have a heart attack dealing with this. If you're not careful.
Mm. Yeah. And I didn't know because um when you're first there, they,
Hmm.
I don't know if it was the same for you, but they put everyone on the blood flow of 400.
Yeah, that's not good.
Yeah, and I told him, I said, listen, I said something doesn't feel right. I don't think
Hmm.
I can handle that.
Hmm.
Um, and gradually I could feel my body getting worn down.
Hmm.
So that eventually, you start experiencing heart issues, and you're like, you know, this wasn't the case before.
Hmm.
So for me, that would have been one of the things that I would have asked a lot of questions on, and more likely I would have told myself, listen, you don't need to start at 400. You could start at 300, and still get a decent treatment. Um, so so now you mentioned you was at another dialysis center before.
Yeah.
Uh, how was your experience there?
Uh, well, it wasn't all that bad, but there's a lot of things they could have done better as far as treatment wise.
Hmm.
Um, I'm not gonna. I don't really have anything negative to say about them,
Hmm.
but it could be better. But you have a lot that was professionals, and you had a lot that you know needed some work. But I'm not going to say their names, or anything like that. I
Yeah,
don't want. Yeah,
yeah. This is not what the conversation is even about. It's just
yeah,
about you know um, real sharing real experiences.
yeah.
That
This is real
someone else
experience.
is gonna go through this, um,
Mm-hmm.
and I know when I found out I had a kidney issue, the very first thing I did was look on YouTube,
Mm-hmm.
and for me, I um, I saw there was this one video. That was it, of someone, and they were talking about doing peritoneal dialysis. Uh, and peritoneal dialysis, I'm not sure if you're aware of it. It's the one that it's in your stomach.
Your stomach, yeah, it's
Yeah.
in your stomach.
And I tried that, and that was the worst experience ever.
Yeah, you can't even swim with that,
Yeah, yeah, you can't.
and it could easily be affected.
Yeah. So
Yeah.
so I had to get rid of that. But
Mm-hmm.
you know, I felt if there were more videos that I could say, okay, well, this person experiences this person experiences that. Okay, I think I understand. I know what tools I have and what questions should I ask. So I'm on a better footing, because I wouldn't want anyone to go through, what I've went through in the past to get to this point.
Mm-hmm.
Uh, so you mentioned that you had to go through heart surgery
Yes,
from the dialysis treatment.
yes.
Were they able to resolve it, or like what exactly happened?
Well, the valve in my heart basically came a little loose, like all right, in your heart, you have these flaps
Okay.
that blood comes in.
Uh-huh.
What happened was the flap was going the wrong way
Mm.
and the valve was messed up. So they had to repair the valve and repair these flaps.
Okay.
I'm not great at names, but I could tell you physically how they work. And it's just flaps. They allow, oh, excuse me,
Yeah.
they allow blood flow. So that had to be repaired because the dialysis, the pull was so hard.
Mm-hmm.
The flow and the pull was so hard because the guy were at the other, not the one that I'm currently in, but the guy in the first one. What he would do, tell him like, listen, take off 2.5 or 3.
Mm-hmm.
Guy would take off 4
Mm.
and have your thing on high. Now, mind you, my usually weight that I carry was like 260, 270.
Mm-hmm.
That's how much I weighed before I was on dialysis. I went down to I lost weight and I was down to like, let's just say 200. This guy would drain me so viciously that I went down to 185.
Wow.
I've never been 185 until that point in 36 years of my life.
Wow.
The last time I was like in ones, I had to be like 16, 17. I'd never been that small. And then I was sluggish. I would walk around, I would get sluggish. I couldn't keep up with my sons.
Mm.
And this guy would do it. He would act like I didn't know what I was talking about. I'm like, are you kidding me? Are you for real? But yeah, I had to.
Did you talk to anyone else about that?
I've talked to my mother about that. She was the one who recommended me to cut ties with that dialysis center. I really didn't want to because I have made some friends and I've had made friends that became like family members. That's what happens when you go into this type of situation. We all have everything in common. But my mother basically said, for your health reasons, I think you should need that. If you're not gonna if they're not gonna reprimand this person, then you should leave.
Mm. Yeah.
And pretty much that's what happened.
Okay.
Yeah.
Okay.
So,
So after the heart surgery, how was your recovery? Are you fully recovered?
yeah. They did a great job. And yes, I'm going to mention the name. Mount Sinai cardio, in my opinion, in New York City, whoever's watching this, this is to all y'all. This is to you too, and this is to all y'all. In my opinion, Mount Sinai cardio is one of the best cardio doctors in New York City. I made a full recovery. Yeah. I didn't even know. And when they put you to sleep, it's a deep sleep, that they watch over you. They show that they care. They treat you like a human being.
Mm.
They have one of the best cardio centers that I've been. hands down.
Mm.
The best doctors and the best operator is in Mount Sinai. And I'm gonna say it is what it is.
That's good to know.
You know, anybody, I recommend them.
Okay, and after the surgery, and now you're back to your same activities you was doing prior to the surgery.
Yes, pretty much.
Okay.
Going to go around and stuff.
Okay.
Hang out with my sons whenever I get the chance.
Yeah. Yeah.
So
Family is important.
yeah, that's why I'm here.
Yeah.
That's why I'm here. So I consider myself very fortunate because, to be honest with you, I wasn't feeling anything. That's how bad it was. I wasn't even feeling anything. They discovered it themselves during a kidney center evaluation.
Well, so you didn't realize that was valve loose?
I had no clue, and they picked it up because when you gotta go through your annual checkup, but when you about to get your transplant and stuff, if you want to get a transplant,
yeah,
you gotta go through an annual checkup like every year. They discovered that. I had no clue. I wasn't feeling anything. I went when I found out, I'm not even gonna lie to you, I was distraught.
Mm.
Heart surgery? What the
Yeah.
heart surgery? I'm calling in there crying about I gotta go to heart surgery. My sister's like, yo, calm down. My little sister's telling me to calm down, and I'm crying to her. Heart surgery. Yeah, but yeah, we did the colon surgery. They did a terrific job, and I'm happy to say, I'm back to normal. I'm doing the things that I was able to do.
I'm glad to hear it. And that story is going to give hope to a lot of folks that going through the same issue, and don't know what to do. Because the problem is sometimes, you're going through these things and you don't realize there's other folks that are faced with the same issue. You think you're at it alone, and people don't talk to one another. So I know someone gonna see this and they're gonna say, well, this is exactly what's happened to me. These are the steps I should take. And they may even consider Mount Sinai because they did such a good job for you. Before we wrap up, though, part of this is to share a story also, but there's going to be folks that's going to watch this and they're going to say, hey, I'm interested in seeing if I can donate a kidney to you. If someone is interested in donating, how do they donate to you?
I would say talk to the people at Mount Sinai.
Okay.
Because that's one of the places that handles anybody, donating. Or you can go to Philadelphia, the what you call it for Philadelphia, the hospital in Philadelphia.
Albert Einstein?
Like I said, no, it's not Albert Einstein. Like I said, I'm terrible with names.
No, that's fine. If you can text it to me, because
sure.
At the end of the video, I'm gonna make sure to have like a card there with the information that you provide, so folks can, because I know for myself, like they have to call the hospital, give my name, and then to go through the process. So what I'm gonna ask from you is that you send me that, and that's gonna be at the end of the video segment, that information, because people are going to see it and they want to know how can they, how can they go check to see, and sometimes it's just complete strangers.
Yeah.
That's
Look, if you don't mind, do you mind me taking the time to say something?
Yes. Yeah.
Look, I'm going to tell you this, and I'm going to tell you this, like, be honest. You're not alone. There's people out here that's trying to help you. You know, it's going to be hard. It's going to be a whole life change. It's not the end of your life. It's a life change, a lifestyle change. That's it. It's nothing more, nothing less. You know, you just change your lifestyle and change certain habits, you know, especially the habits that got you into the position that you're in right now. But you're not alone. Listen, talk to people, talk to your fellow people who are on dialysis, your fellow patients. Talk to there's counselors that are here to help you, you know. Stay on it, stay consistent, and believe me, man, you'll get through this.
Great. You've made it to the end of this video. Before you log off, I have only 2 asks from you. One, help us get the word out. You can do this by subscribing to this channel and liking this video. This will help with the algorithms. 2, consider donating a kidney to Jerry. To contact Jerry directly, his email is right below, or you can contact Renal Rights. Thank you.